Thank you for tuning in to this demo presentation. This one will focus on COVID-19 and climate change. This presentation is based on an online research tool I worked on with Mural Arts Philadelphia. It's called covidandclimate.com. And in the longer presentation, in the full scope of this, and also in the workshop, we're going to dive very deeply into the different dimensions of COVID and climate. And this is how, if you visit the website, you can see that each topic is divided into a certain dimension. So there's labor, bodily organic, there is political dimension, there's all these different dimensions of this situation with COVID-19 and climate change. And what we're going to focus on today in this demo presentation is zoonotic diseases and the fact that COVID-19 is a zoonotic disease and that zoonotic diseases are very much linked to what's happening with our climate and with our environment. So COVID-19 is the latest zoonotic virus to emerge over the past 40 years. It's very important for us to view COVID-19 in its proper context, not as something that just randomly appeared out of nowhere and we have no idea what it means, and we have never seen anything like this before. Many of us, we know or have heard that COVID-19 originated in some kind of wildlife like a bat or a pangolin. This is not the first time this has happened. So all of us know about HIV. This was first detected in 1981 because of people eating bushmeat, supposedly in Africa, and killing these animals and getting the blood on themselves, and that's how HIV apparently entered into the human population. Then we had SARS in 2002. The avian flu came via ducks in 2005, swine flu 2009, Ebola 2014 that also came from a monkey as well. We had Zika virus in 2015 from mosquitoes. And then we had bats again bringing us COVID-19 in 2020. And then we also have things like the chicken pox, which we'll get into later. So many of the diseases and many of the conditions that we're used to living with actually originate in animals. So zoonotic diseases are transmitted in a variety of different manners. There's the direct transfer if you're like working with animals on a farm. There's also like if you're in close proximity to their bodily fluids or their feces. Then there's a transfer of viruses between animals. So many of us have heard of the possibility of a pangolin giving a virus to a bat or vice versa, and then that mixing and then somehow getting into a human. So the viruses are circulating in the animal population as well. And of course, we don't know about it until it enters the human population. Then there's also zoonotic diseases that are foodborne, so from eating infected milk or meat. And then there's also, direct contact with an infected animal, like getting rabies from a raccoon bite or something like that. I love this diagram that was created by the artist Margaret Kearney, who really helped develop most of the visuals for this COVID-19 and climate change project. You can see there's kind of like a matrix of all of these different zoonotic diseases that have been swirling around in society, kind of like bubbling under at a low level in some populations. And then every so often, there's this huge eruption like what we're seeing right now with COVID-19, where it goes global. All the virus has to do these days is hop on a plane, and then it can be easily transmitted all over the world. It's very important for us to realize that pandemics are very much a consequence of our dysfunctional relationship with the natural world and other animals. So we see this guy here in a hospital bed in the middle of the diagram. All of these things swirling around him are contributing to disability and death in the human population. So we have live animal markets where animals are turned into commodities and often held in very poor conditions, where viruses and diseases and bacteria can very easily spread through these crowded animal farms. We have wildlife hunting, and many of the animals that are being hunted are endangered as well. So that's also problematic. We have domestic animals. So we have like avian flu, bovine the mad cow disease and so forth. Then we have intensive wildlife farming, which is a little bit different from live animal markets, which means you're actually keeping these wild animals in a certain confined space to farm them, to breed them. And we do believe that this is how COVID-19 came about, keeping bats, keeping pangolins in these wildlife farming markets. And all of this is very dysfunctional. I've been thinking more and more about veganism. I'm not a vegan right now, but when you examine how our dysfunctional relationship with nature and with other animals is producing all of this death and disability and disease, we really have to re-examine our relationship to animals and to the natural world. And we have to think, do we need this industrial farming? Do we really need to keep doing things the way we're doing them? I think what COVID-19 is telling us in a certain sense is that we have to re-examine what we take for granted, and that the way that we've been doing things so far is definitely not working. So we talk about the effects that COVID has had on the population, especially here in the United States. We have to understand that when people don't want to wear a mask, when they don't want to get a vaccine, there are social consequences for that. People of color have had higher rates of infection, hospitalization, and death due to COVID, in part because most of the essential workers who are on the front lines of dealing with the public, many of these people are people of color. So if you have a bunch of people in a restaurant who don't want to wear a mask, who are the workers in the restaurant? Who are the people who are taking out your trash? Who are the people who are doing all the jobs, bagging groceries at the grocery store? At any point of contact between a consumer and a store or some kind of shop, there's often someone who works there who's like the go-between, who you have to deal with. And when we have a situation where many people, because of their own comfort level or their own convenience, don't want to wear a mask or don't want to get a vaccine, that has very negative ripple effects for people who are already suffering from disproportionate issues because of racism, because of historical trauma, because of lack of resources in the community, because of lack of access to healthcare. This is why you see Native Americans, Black people, and Hispanic people have a far higher caseload, hospitalization rate, and death rate than white people and Asians in the United States. But there's a way out of this. And I mentioned it briefly before. I think part of the way out of this is re-examining all of the systems and institutions that we take for granted and really asking ourselves, are these things serving us moving forward? And I love this image from the COVID-19 and climate change website. I think this one was created by the artist Yuri Jones. And I love this because it says, to care for each other and our planet, we should stop viewing nature as a resource to consume. We must remember that we are a part of an interconnected ecosystem and nurture regenerative growth. So this means that instead of viewing animals solely as something for us to eat or wear or something that is just useful for us, we should start viewing ourselves as part of a community of life that exists on this planet where, okay, hunting may be okay in some situations, or fishing or harvesting animals. I'm not saying we have to totally stop eating animals altogether, but the wholesale slaughter and enslavement and abuse of animals is definitely what's underpinning these emerging zoonotic diseases. And if we want to stop these diseases from emerging, we have to reconsider how we engage with the other creatures who live on this planet.